Your home health agency just worked an entire claim from start to finish. Your clinicians documented everything, you submitted it on time, and now it's sitting somewhere in your billing process, unpaid, and you have absolutely no idea why. In the next few minutes, I'm going to show you exactly why most home health agencies are flying blind when it comes to their revenue, and more importantly, how proper home health reporting can help you find and recover the money you're already owed. Here's the uncomfortable truth. Most home health agencies know something is wrong when cash flow dips or accounts receivable balloons out of control, but they can't actually see the specific problems causing these issues. They're making critical business decisions based on incomplete information, outdated reports, or worse, just gut feeling. And that's costing them real money. So let's talk about what's actually happening when you don't have proper home health reporting capabilities. You've got claims stuck in documentation limbo for weeks with no visibility into which clinicians are causing the bottleneck. You've got revenue being written off as uncollectible when it absolutely could have been recovered with proper follow-up. You've got referral sources that look profitable on paper but are actually draining your resources because they require way more visits than they should. And here's a big one: low utilization payment adjustments, or LUPA, that dramatically reduce your episode payments when visit thresholds aren't met. Under PDGM, these thresholds range from 2 to 6 visits depending on the patient's case mix grouping. Without real-time home health reporting that tracks this, many of these LUPA are completely preventable, but you'd never know until it's too late. Now here's what's interesting. The problem isn't that the data doesn't exist. It absolutely does. The problem is that your EHR system was never built to give you this information in a useful way. Most home health EHR systems were designed for clinical documentation and compliance, not financial analytics. Nearly all practice management and EHR systems are fundamentally inadequate at revenue cycle analytics and reporting. Why? Because healthcare organizations purchase these systems based on clinical workflow capabilities, not reporting capabilities. So what do you end up with? Data vomiting instead of actionable insights. Your EHR might generate dozens of reports, but can it actually answer the questions that matter? Questions like, where exactly is your revenue stuck right now? Which clinicians consistently have unsigned orders that are holding up claims? What's your actual collection rate, not gross charges, but money actually received compared to what you expected to collect? Which referral sources generate sustainable margins versus which ones require so many visits that they're actually unprofitable? Most systems can't answer these questions, and that's a massive problem. Let me give you a specific example of how broken some of these systems are. WellSky denial reporting is fundamentally inadequate. The platform lacks basic sorting and filtering capabilities. Agencies can't group denials by payer, by denial code, or by clinician responsibility, which means you can't identify patterns and actually solve problems. Which payers deny most frequently? Which denial codes keep recurring? Which clinicians need additional documentation training? The system can't answer these questions. So agencies end up manually logging denial reasons in spreadsheets just to do basic analysis. That defeats the entire purpose of having an EMR system in the first place. But here's the thing. When agencies implement robust home health reporting capabilities, the financial improvements are measurable and often significant. One client discovered through proper data analysis that substantial revenue was being left on the table because claims were stuck in physician orders. By prioritizing these stuck claims and addressing the root causes, they recovered revenue that would have otherwise been written off. Another agency kept seeing write-offs from untimely notice of admission filing. These losses didn't even appear in standard reports because they happened before claims were submitted. Without proper home health reporting, they had no idea this was even happening. Here's a real success story that shows what's possible. One of the larger home health clients we work with was constantly fighting missing documentation flags in their Access billing center. Their clinical team was burning hours without any clear roadmap for which claims actually mattered most. So we extracted detailed aging data directly from Axis and built a priority matrix that ranked pending claims by both age and dollar impact. Instead of chasing every flag equally, the clinical team could focus their documentation efforts where it actually counted, the highest value claims first. The result? A 20% reduction in days claims pending. That translated directly into improved cash flow and freed up clinical staff to focus on patient care instead of paperwork chaos. Access Billing Manager doesn't make this kind of prioritization easy, but custom reporting gave leadership a clear priority list they could hand to their team, turning billing from a bottleneck into a strategic advantage. So what should effective home health reporting actually look like? You need real-time AR, aging with the ability to drill down to specific claim details. You need monitoring of claims moving into later aging categories before they become uncollectible. You need clinician-level productivity and documentation quality metrics that show you which team members consistently have documentation issues. You need proactive problem detection like LUPA threshold tracking and monitoring of untimely NOA filings before they result in lost revenue. And critically, you need the analytical expertise to interpret all of this data and drive actionable recommendations. Having data is one thing, knowing what to do with it is another. The difference between basic reporting and strategic home health reporting is the difference between knowing you have a problem and knowing exactly how to fix it. The agencies that thrive in home health aren't necessarily those with the highest volume or the most referral sources. They're the agencies with the best visibility into their operations, the ones using home health reporting to make informed decisions that protect and optimize revenue. Your clinical team works too hard, and your patients deserve too much for revenue to leak away due to preventable problems you can't even see. If you want to see exactly where your agency is losing revenue in the billing process, book a call with our team at Core Billing. We'll analyze your specific situation with home health reporting insights and show you what's actually happening with your money. If this was helpful, make sure to subscribe so you don't miss our next video on home health billing. Drop a comment below if you've struggled with getting useful data out of your EHR system. We'd love to hear your experience. And share this with another home health agency owner who needs to see it.